There's so many people. This is awesome.
No. Good evening. Welcome and thank you for joining us this evening for our conversations with CKG discussion, ADHD, understanding and supporting your teen. I'm Susan Lindsay, Director of Programs with the Cameron K. Gallagher Foundation. And this is part of our Conversations with CKG discussion series. So this discussion series is a community platform which seeks to turn the whispered hidden conversations about mental health into open, supportive, educational dialogue. We would like to extend a very special welcome to any teens who may be joining us tonight, and we thank everyone for having the courage to join us and speaking up. Due to the large expected turnout tonight, we ask that you stay muted and use the chat feature to ask questions by clicking on the chat dialogue icon that's along the bottom of your screen. A special thank you to Haley Dalton, who will be managing the chat for us and helping to manage the questions tonight. We will do our best to get to as many questions as possible. And I will kind of run through the order of the topics that we're gonna cover. So if you have a question and you're wondering, like, when are we gonna get to it? You kind of have an idea of the layout of the topics tonight. So an audio recording of tonight's conversation will be available on ckgconnections.com. Our March conversation will be a book discussion of The Explosive Child by Dr. Ross Greene. So I think that will be a great follow-up to this conversation for a lot of folks tonight. We are joined by licensed marriage and family therapist, Ashley Morgan Sukup with Summit Emotional Health. Ashley works with children, adolescents, and adults specializing in post-traumatic stress disorder and trauma, marital concerns, anxiety, depression, ADHD, substance abuse, and behavioral concerns. So specifically, Ashley assists individuals and families in exploring new patterns of communication and relational engagement to support one another and promote long-lasting change within the family. So welcome, Ashley, and thank you for being here tonight.
Thank you, guys. I'm so excited to be here. So before we start, and I want to encourage everybody, please ask questions. And I tell people who've been here before, I can talk all night long. I love to hear myself talk, but I also would really like to hear questions from you guys and any perspective you might have. You all live with your kids 24 hours a day, and I'm sure you guys have a plethora of experience. So any kind of insight or guidance you have for one another, feel free to put it in the chat box, and Haley can help kind of provide that information, as well as any questions you might have that I'm not answering or things specifically, you can ask those too. So I'm really excited about this presentation because I do think I probably empathize the most for kids with ADHD. I think it's probably one of the diagnoses that are most misunderstood among our youth. I mean, you often hear kids with ADHD or behavioral problem, or you're unmotivated, or you just don't care and you need to try harder. Or really, I think 9 times out of 10, if you have a kid with ADHD, they want to do well, they want to try harder, and it's just very, very difficult for them. So I hope you guys can walk away today with a better understanding of what ADHD really is, what the symptoms are, what it might look like, how it can present in different ways in a multitude of different children, as well as, how best to support them. So to start, Susan, I'm sorry, you want to ask the first question?
Yeah, and before that, I'm going to just run through real quick kind of our outline of topics because there is a lot. I mean, we could take any one of the questions that I ask Ashley and spend an hour on it. So we're going to try to hit as many facets of ADHD as we can tonight and to provide you with some online resources as follow-up that if you have a particular aspect that you want to dive deeper into, we'll give you some resources for that. So we'll talk about what ADHD is, parenting styles, processing information and stimuli, how ADHD presents differently in boys and girls, puberty and ADHD, labeling and stigma, concerns with diagnosis because of labeling, the top 3 to 5 things parents can do to support a teen with ADHD, pros and cons of medication, alternatives to medication, drug and alcohol use effects on ADHD, and then we will kind of wrap up with parenting with ADHD. If you are a parent that has ADHD and you're parenting a child with ADHD. So that's a lot. So we'll go ahead and get started real quick. I know some people were still popping in during the introduction. If you can please stay on mute. This is just the meeting function of Zoom, and so we don't have the capability to actually mute you. So just to cut down on background noise for everybody, because we have a large group tonight. So Ashley, let's start with, what is ADHD? It's such a common term, we hear it all the time, but I think there are still so many stereotypes and misunderstandings about what it is. And then also, whatever happened to ADD?
Okay, great. So ADHD is attention deficit hyperactivity disorder, and it's a neurodevelopmental disorder that can be identified and presented, and research indicates even as early as 4 years old. There's MRI imaging that it'll affect you as young as 4, and then may even last or lead into adulthood. And there are several scales, and I'll talk a little bit about what the neurodevelopment piece means in just a second, but there's several scales and evaluations that can be used to kind of characterize or identify ADHD in individuals, but they all go back to this Diagnostic Statistics Manual, the 5th edition. And that's basically like the therapist's Bible in terms of diagnoses. It has a lot of symptomology and presentation, and that's really how it characterizes. So with this diagnosis, or with the DSM-5, there's 2 different pieces. There's the hyperactivity impulsivity component, as well as the inattentive component. And ADD historically was differentiated as attention deficit disorder, meaning I was distracted, I couldn't attend and focus in, but I wasn't a behavioral issue. Where now the DSM-5, because of the latest research, much attributed to these MRI imaging, they realized that the brain volume, even as early as 4 years old, kids' brains with ADHD, they might be smaller in volume, so they're like growing less quickly than other individuals, as well as how they activate, or areas of the brain, really how they talk to each other, they're less activated in ADHD brains than they are in healthy functioning brains. And I want to say healthy functioning, but because I don't have other words for it, but really like ADHD brains are healthy functioning too. They just present or look a little bit differently than other children. So what does that mean? Really, when you're looking at Diagnostic Statistics Manual, or a kid comes in with ADHD, they have to meet 6 or more symptoms in 2 different domains. One being inattentive symptoms and the other being hyperactivity impulsive symptomology. If you are 17 or older, so there's a lot of kids who are misdiagnosed and they come in, they have a lot of struggles in college or even late high school because work's gotten harder. They present as unmotivated. They just keep saying like, I can't attend to anybody, and they might be really irritable. They'll come in my office and they need to be presented or have 5 domains or symptoms within each of these categories. So I want to speak to those. Inattentive symptoms, they often make mistakes, appear careless either at school or at work, and that's really important. It has to be across 2 domains. So if you are seeing at home, and I'll see this a lot, parents come in, they say, hey, I'm really seeing they're really irritable. I can't get them to complete their homework. They're having a hard time focusing, present as distracted. They keep getting up every 5 minutes before they complete an assignment, but that's not presenting at home, at school. They might not meet criteria for ADHD. The caveat is, as a therapist, we might know, hey, they have it. They're just savvy enough to hold it together in school, or they aren't acting out, or they aren't impulsive, or they aren't reactionary, and there's multiple children in the class and they're kind of flying under the radar. So it could present at school. It could present in social situations with friends or peers. It could present in sporting activities or events. It could present at home. So we can be a little bit savvier in how it's presenting and what it's looking like, and also ask another series of batteries of questions to be able to get to a better diagnosis. So again, makes mistakes or appears careless, has difficulty maintaining attention on school, work, reading, or fun activities, does not appear to listen during conversations, even one-on-one. That's a kiddo who, and this is where it gets savvy and interesting. You might have a kid who you'll say, hey buddy, what'd you do at school today? And they're over here and they hear you, hey buddy, what would you do at school today? And they just don't respond because they're focused and attending the game. They're hearing you, they're not hearing you and then processing, I need to disattend from what's going on and playing a video game or watching TV and actually have a reply. And that's the executive functioning piece that's inhibited or they struggle with. Following through on instructions is always a challenge. They might need 2, 3, 4, 5 prompts to be able to give an instruction. One of the good things that you can do is really get on their level, attend, put your hand on their shoulder and look them in the eye and say, hey, here, I need you to go pick up your shoes and put them on, or, I need you to go get the car stuff out of the car. Do you hear me? What are you getting out of the car? And let them repeat. So we're using multiple different stimuli or processes to be able to get the information kind of to the brain and out of their mouth or to the feet. And then finishing a task or homework from beginning to end is rare due to getting sidetracked or losing focus. Also, tasks are avoided often that involve mental effort for long sustained periods of time. So if you think about it, middle school, high school students, well, the schoolwork, they now might have to sit for an hour and a half to do their schoolwork, and they're having a hard time being able to do that. So guess what? It's too much sustained effort, particularly after spending 7 hours at school. So I'm going to ignore doing my homework. And it's not that they're not motivated, it's that takes such bandwidth, and it's so mentally taxing and exhausting to be able to sustain, attend and be able to do that.
Hey, Ashley, is there a spike in diagnosis around middle school? Because that's when those skills, are really needed. School gets harder. There's more expectations. You need to be more organized. You have more homework. Do you see a spike in diagnosis around then?
Often, particularly if they haven't been diagnosed before. So if you've been diagnosed before, previously, it might see a spike and there's more changes around middle school because it's getting harder. The effort or the skills that they've learned and acquired, they might have to find new ones, or they're having a hard time kind of being able to continue to pull from those because they're needing such sustained effort to attend and focus. And then there's kids that have really, if they have real, a really strong IQ, really strong work ethic, and they've been really savvy in the school setting, and now it's getting harder. 5th, 6th, 7th grade can be really difficult. And really that 5th grade year, hey, we're really starting to kind of ramp it up to give them autonomy and independence. And that's where they struggle. I'll hold your hand in kindergarten, 1st, 2nd grade. I'm going to kind of help you through those executive functioning skills. So working memory, flexibility, transition time, issues with organization. Those are kind of all built in. Well, once you hit 4th, 5th, 6th, 7th grade, it's almost expected that they're supposed to do it all of a sudden. They know how. But if there's such a lag in that development, they're not ready. They're ill prepared to be able to function. So yes, you do see that often that's when they might start getting diagnosed more. And often that happens a lot with females, with girls versus boys, because boys tend to be more of a behavioral problem historically. In classroom, more hyperactive, more impulsive, more externalizing behaviors versus girls who are more internalizing. They're kind of flighty. They might play more in their desk. They might be more impulsive in speech or just talk a lot more, whereas boys tend to act out behaviorally.
Ashley, I kind of have a follow-up question to that. I don't know if there's been any data on if there's been a recent spike in diagnoses with kids doing school virtually or not.
So I will tell you, I can imagine there might be. However, one of the biggest pieces of diagnostic criteria is that these symptoms have to present from at least 6 months, and it cannot be explained by another mental disorder or other thing going on. And because they'll come in my office and say, I think I can't focus or attend. Well, we've had a huge situational factor or trauma that people are going through, and we're teaching them or making them learn a different way. And it's hard then to diagnose ADHD because there's such a situational factor that's presenting, where it could have been there previously, but I guess we need more data and information. And I would always go back, multiple of these symptoms that we're talking about have to be present prior to age 12. So I would say, okay, it's presenting now, great. But also, did it happen at 4, 5, 6, 7, 8? What did that look like? And if you dig in, you'll say, oh, well, no, they weren't ever getting in trouble at school. Well, talk to me about when they're hanging out on the playground. Were they the ones that were playing in the group and playing sports or swinging on the swings, or was everybody swinging on the swings, hanging out, and they would veer off in the middle of conversation and go, climb the fence or go kind of do cartwheels in the middle of a soccer field, that kind of thing. So there's 2 more inattentive symptoms: can be easily distracted by external events, and also is forgetful while doing everyday activities like chores and errands. So that's a funny one. I'll be very honest with you. I grew up with ADHD. I, as an adult, still have ADHD. If any of my clients, I'm sure some of you might be on the call, you guys can attest, my desk is a hot mess. I'm very disorganized, always know where my piles are or what's in my pile. Just can't guarantee there's not going to be one. So, and some of that is I'll forget, I get in the middle of stuff and I might forget to put my pen back into the pencil, the pencil holder, or, the follow through is not always there, if that makes sense. Hyperactivity and impulsive symptoms. Being physically still is a challenge. Will move feet, hands, squirm in their seat. They might be one that they're bouncing, or they're always kind of putting their feet up, or they're rocking back on their desk chair, or staying seated again is really hard. They'll want to get up and move around. This might present, if they're really savvy, is, hey, I need to go to the bathroom, or I need to get a drink of water. And that's what they've learned. I need to go get a break. I'm going to ask for something that's appropriate rather than me just getting up and walking to the desk. I had a little boy that came in. He's like, I got a clip down today. And I was like, well, why'd you get a clip down? He's like, because I got up and I started like rocking in my teacher's reading chair. And I was like, well, why were you rocking in the reading chair? I don't even know why I was there. I have no idea. And it was just kind of this, he had no self-control, impulsive reactions, started rocking, and it was very stimulating for him, but not at all what he was supposed to be doing. So they'll run or climb at unsuitable times, or again, rock in rocking chairs. Teenagers and adults, because they, brains continue to grow and develop. You're not fully developed until the age of 25, right? And even after that, we're still kind of creating neural pathways, and we're still growing and evolving. So you can acquire skills. They might be savvy enough to know I can't run or climb. I'm not going to do that. So I can sustain kind of my hyperactivity. But I'm going to shake my knee, or I'm going to tap a pencil all the time, or I'm going to be fidgeting with paper. They just look, and it might appear restless rather than actually jumping and running around. Rarely or participate in hobbies or play activities quietly. So they might be whistling or singing or yelling at the top of their lungs, or will make wild noises in the middle, like a monster in the middle of playing Legos, that kind of thing. Has lots of energy and is frequently described as always on the go or driven by a motor. One of the stigmatizing things about ADHD is that kind of always on the go or driven by a motor is perceived as being a bad thing. It doesn't mean that they're hitting or kicking or throwing, or, they just might be really active and focused and curious on a lot of things. Well, that can be really great if it's channeled appropriately, but it's also can be very exhausting for people who aren't used to that stimulation. The difficult part is when kids are little, they don't see it as an issue. And then they get yelled at because they're supposed to be sitting still or be calm. Why can't you just calm down? And they're getting yelled at, and they're like, that kind of breaks their confidence, where we had to help them to channel that hyperactivity, channel that motor in a way that feels more, appropriate, or kind of given what their task is. Talks continually and might be known as a chatterbox. This again can result in problems at school or work. Will ask questions before they've been fully, or answer questions before they've been fully asked. So they'll just blurt out the answer, which you can imagine if you're taking a test might be a problem, or interrupt others while they're talking. And just not even, and it's not that they intentionally want to be disrespectful or rude, but if you think about it from an executive functioning standpoint, that's all the frontal lobe piece, right? Like your working memory, you're supposed to be able to hold information, be able to then filter out the information unconsciously of, I'm not going to attend to that right now, and I'm going to focus in on this. Well, they might not be able to splice it out. It comes right to the top of their mind, and then it's got to come out of their mouth. And it's this impulsive reaction, and we perceive them as being rude, but really they physically cannot hold the information in their brain, and it's got to come out or it's lost. Waiting for a turn is difficult. Again, that's a self-control, impulse control stuff, whether that's play in a line during a conversation, and then often might intrude on other people's activities or conversations. So I'm sure you've seen the individual hey, I'm going to play right now. like, let me join in. And then they might get upset or really irritable if somebody says, well, we're in the middle of playing a game and they can't play. Or we're in the middle of, engaging in a task or doing a group project and you jumped in and you gave me your feedback. Well, I'm not ready for that yet. Other people aren't ready. You need to wait. We're kind of have a process. Well, they're having a hard time understanding and being flexible. Like, why can't I just give you my information? If that makes any sense. So again, if you're 16 and under, you would have to meet criteria, and it would be hyperactive and impulsive type. You would need 6 symptoms from that checklist present. To be an attentive type, you would need 6 symptoms from that checklist and present. If you have 6 or more of both, then you would be classified as attention deficit hyperactivity disorder combined type, meaning you have both of the different subcategories, or you can be specifically one or the other. Any questions about the categories or symptomology or how it presents?
We did have a question about a child, I'm not sure how old, but she loses her temper really quick when I ask her to do something several times. How can we address this piece of it? I can totally appreciate this. I have a child who does the same thing. And I will let Ashley answer that, but I also want to preface it that please come next month to our book discussion of The Explosive Child by Dr. Ross Green, because I think that will be really helpful and a much more in-depth answer than we'll get to tonight.
And hi, that's me. That was my comment. So my daughter, she's 15 now. She was originally diagnosed early on. It was like kindergarten, first grade. She could not sit still. She was always playing with her shoelaces, couldn't focus on a task. She could never finish anything in class. So we medicated her through 5th grade. And then she started doing really well in school. She did not like the way the medication made her feel. So we took her off of it, and she's been off since then. She's a 9th grader now. She does great in school. She can focus on her homework. But anything beyond that, she just, you tell her to do this, it's like 5 minutes later. Oh, did you tell me that? It's just that constant not remembering, or if, oh, did you pick up your shoes? Oh, well, then she gets mad when I remind her, because I have to remind her, and that's when she loses her temper. So I don't know if there's something that can kind of be done around.
So yes, I'll speak to that for a second. A couple things that are going on is ADHD, and this is where it's often misunderstood, is there's a difficulty in being able to process sensory information or stimuli. And Susan, I'm going to jump to that question now to be able to speak to it. I want you guys to imagine, say you're in the middle of doing work, right? You're kind of working. You're trying to get dinner going. You can multitask because your brain's able to do that. And then you have somebody walk up behind you and they're like, Mom, 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 Mom. What's your reaction? Like, what? Like, what do you need? What? That's that kind of, you have the self-control to give a what rather than like an explosion. Well, think about kids who have ADHD. They have that hard time being able to transition from one task to the next. They have a hard time of being able to compartmentalize information and be able to hold it and let it go. So like kind of let go of that stimuli and then focus on what the task at hand. And that takes a lot of effort and sustained energy to be able to do that. And in this case of this young individual that we're conceptualizing, she's gotten to where she can do it very well, but it takes such fatigue and mental fatigue to be able to do it. Then when we're home, like we lose the bandwidth, and then it's like, what now? And often that's where you see a lot of presentation of irritability, aggression, explosiveness of like, I'm either focused on the task that I've had going on or my transition. I have a plan for my day because that's how I've structured my brain so I can attend to everything I'm supposed to do and try to hold it together. And when you throw a wrinkle in it, it throws me for a loop.
I mean, you've literally described her. When she comes home from school, straight on her homework, she's doing her homework for whatever, dinner's ready. Well, I can't, and like she blows up because I'm telling her to stop what she's doing to come down and eat. So I try to give like, all right, start wrapping up, 10 minutes, 5 minutes. And then sometimes she'll even forget that I told her that dinner's ready. So you literally just described my daughter.
So it's very common amongst kids with ADHD, and there's a lot of processing of sensory information. So just to piggyback on that too, guys, if you are, you have children and adolescents, they might go in, we'll see it with video games. People with ADHD, they have a harder time being able to get on a video game, focus and attend to all the different sensory information and stuff and stimuli that's going on. And then we get off the game, right? And then we explode. There's that piece. There's also the other piece of, hey, I'm in a large social group. Maybe they're at a football game with a lot of people and they enjoy it and they're having fun. Well, it takes a lot of sustained effort to be able to listen to the band, watch the game, focus on your friends, have those conversations and be able to internalize and hold it all together and know what to filter out. So they're working really hard and then they come home and either they're completely unmotivated and look exhausted and don't want to engage at all, or they come in and they're fishing for a fight and they're irritable.
So what's the best way to
you.
address that? I was gonna say, what's the best way to address that to avoid the blow-ups?
So
I'm gonna jump in here, Ashley. So I do really encourage you to come next month, and we do thank you and thank everyone for all their questions. Just a friendly reminder for those who came in a little bit late and missed the introduction, we do have a really large group tonight, so we're asking that everyone remains on mute and you chat your questions. And we still have a lot of topics to get through pertaining to ADHD. So I'm going to move us on to parenting styles, which I think will relate to this also. So this is going to sound maybe like a strange question, but can a certain parenting style like cause ADHD, or those reactions that question was just those explosive reactions, or exacerbate ADHD behaviors? And I say that may sound strange, but I bet that there are a lot of parents here, and I would include myself, who have, wondered like, man, is it just like do I have a lack of discipline with my kid? Or like I watch my friends and they, their kids just like, get right in line and, do what they're asked without like exploding at them. And here I am like embarrassed because again, my child is, exploding. So how would you answer that?
Yeah. So that's a great question. So if often we'll hear, if only they were punished at home, right? You watch if only they got punished, or mom and dad must be really easy on them. And this is my favorite one. Like, looks like they practice free range parenting at home, like in the like snarky comments, or my kids would never act like that. So those are things that like I hear 9 times out of 10 in my office, or even at the playground or at the pool, or, people getting snarky looks in the grocery store when the kid's kind of into everything. So those are all exhibits of a permissive parenting style, or implication that it's a permissive parenting style. Like, I'm not really going to engage. I'm way too loose in my boundaries. I'm way too flexible. And the very quick answer that I can give you is no, a parenting style does not cause ADHD. So that doesn't cause ADHD. And neither does providing your child, and these are myths, like if you give them too much sugar, or you feed them too much caffeine, or you allow them to be on watch TV too much as a child. None of those statistically or in any sort of science and research present that causes ADHD. And we go back to the research and the science that when you literally look at MRI brain imaging studies and scans, the brain volume of these kids is smaller in volume, so their brains are growing at a slower capacity as other children. So there's a developmental lag and delay, as well as how it communicates amongst, within itself, to help with impulse control, all the flexibility, working memory, planning, organizing. So no, you as parents are not causing this. And in fact, I think the biggest piece is some of the biggest stuff with parenting is you want to be firm but flexible. You want to provide consistency in routine and structure, and you want to be nurturing and supportive. And if you are doing those things as a parent, you are doing right by your ADHD child.
Does sugar exacerbate ADHD?
So there's yes. So there are big pieces of this. Sugar can definitely exacerbate ADHD. Too much TV, just like for anybody, can be not a great thing. And then also with permissive parenting style, if we're overly flexible, that implies that we're also not giving consistency and structure and like boundaries, and kids need structure and routine to be able to learn how to like acquire those skills of being able to attend, being able to focus in, being able to transition from one task to the next. So yes, some of these things can definitely exacerbate and the ADHD, but it doesn't cause the ADHD. And I want to give the flip of that too. Permissive parenting style implies no boundaries. Being an authoritarian parent and overly dictatorial and overly aggressive and not giving room for flexibility of like, okay, you're going to go to school and you're going to focus on school all day. And then you're going to come home. And my expectation is you're going to sit at the table and you're going to do your homework right now. And you can't get up and that leads to a lot of concerns and issues too, because it can break down the confidence. Like we're having an expectation for them that they can't attend to, they cannot meet it. And then they want to, and then they're beating themselves up. So we have to be mindful. It's authoritative parenting. Be firm but flexible, consistent, provide structure, and a lot of love and nurturing and support.
Video game exposure at a really young age, is that a risk factor? So I think the question is, can that cause ADHD? Now I know there's concern with maybe a higher level of addiction or having a harder time get off of video games for kids who have ADHD.
So the research that I have found is that it's not necessarily it might not be a risk factor. Like we don't know what comes first, the chicken or the egg, but what we do know from video gaming is kids who have ADHD might have a harder time being with video games that they play for a long time, because even brains that don't have ADHD can show a reduction in in changes in their brain chemistry and their gray matter, which leads to inattentiveness, lack of concentration, distractibility, irritability. So then if you think about it, those ADHD kids, they already struggle with those things. And then we're going to put lots of video games on the top of that. Of course, it would exacerbate it. Does that make sense? But I can't speak to, is it an actual risk factor? Because I don't know the science behind that.
Okay. What are the differences in boys and girls with ADHD?
Let me find my notes here. Yes. So boys are 3 times more likely to be diagnosed. And girls are on average diagnosed 5 years later than boys. And there's a couple of reasons for that. Again, boys exhibit externalizing behaviors, while girls have a tendency to exhibit internalizing behaviors. So I want you to think about, these are kind of more girl specific ADHD traits. And I want to clarify too, it's like a typical or generalization. It's not every kid. And I would say, I told you I was an ADHD kid, and my mom would go out with her friends and she was like, why do my girls not act like my other friends' girls? Because we were off the wall, we bounced off the wall, we were wild, and we kind of acted like boys. So again, if your daughter doesn't present like this or your son doesn't present like this, it's not that there's, it's just a generalization. But girls have more typical being withdrawn, low self-esteem, co-occurring anxiety, intellectual impairment, inattentiveness or a tendency to daydream. And one of the ways that you can characterize this specifically in my middle schoolers, they almost look like their eyes glaze over. And then you'll ask them a question and be like, what? And they come back with this sweet angelic face, like they were just at the beach. And they're like, what? And then they check back in, you can ask them again and they'll, give you a response. With little ones, they might daydream and then they're going to tell you what they're daydreaming about. Like, hey, did you, I went to the movies today and I saw Mulan and it was wonderful. And you're like, wait, I just asked you about what you have for lunch. If that makes sense. Just trouble focusing on their task. It might take them a really, really long time to complete their assignments at school, or it might take them a really, really, really long time to eat their meal. Like if that happens at home, you're feeding them dinner, they might sit there for 35 minutes, 40 minutes. Everybody's been done by now and cleaned up and they're still eating. Appearing not to listen. So I explained before, they're you're talking, you're thinking it's going in and they're not even attending or looking at you. And then they can be verbally aggressive. And this is where the impulsivity piece comes in. They say things without speaking. They might present as teasing more or saying unkind words, taunting or even name calling people. And that's where the impulsivity or risky behavior kind of presents in a girl more than a boy. Boys with ADHD have a tendency to display symptoms that are more stereotypical. Like they're impulsive, they act out aggressively, or like the kid that's on the rocking chair, right? They're impulsive, or they might walk up and bop somebody on the head or call them a dummy. And then you'll say, well, why'd you call them a dummy? Like, I don't know. I just did. And they truly don't know. It just kind of came out of their mouth. hyperactive, running a lot, racing, lack of focus, including just being generally inattentive. They cannot sit still. They're going to be fidgeting all the time. Or if you look at the insides of their desks or even in their rooms, there's stuff everywhere, like little bits of paper, stuff broken up, that kind of thing. Or they're always losing their stuff. They can be physically aggressive, and that doesn't mean they're being physically aggressive, being mean. It's just they're physically aggressive, like they're wrestling, they're beating each other up. There's this kind of physical stimulation. They talk excessively until they go to bed, all the time, and then frequently interrupting other people's conversations and activities, and just kind of jumping in.
Ashley, I kind of have a question, I think related to how those ADHD symptoms may present. So is there any connection between ADHD and anxiety disorder or bipolar disorder? And, can teens with ADHD be misdiagnosed with those things based on how they're presenting?
Yes, they can. And oftentimes you'll see in kids, particularly in teens, with anxiety, they might come in, hey, I'm struggling with anxiety, I'm having a hard time, and they can't hold it. Well, what's happened when you hit middle school, and again, puberty starts around like 10, 11, like it's a lot earlier than we think. And that's also coupled around the same time that we have increased risk behaviors, academic becomes more struggles more, and we're less egocentric. So it's not all about us. We're recognizing like we revolve like around a world and we have impact on other people. And we recognize then like, oh my gosh, I engage differently than other people, or I focus differently, or it takes me longer to do my work, or like I can't sit still and they can. And like, it's just harder for me. Like it shoots down their confidence. And then that creates this anxiety of like, oh my gosh, do other people notice? Or like, what if I can't do it? What if I'm not going to be good enough? So we see a lot of co-occurring anxiety, depression stuff because of the self-confidence issues that come in with ADHD. Bipolar disorder, I'm sure it happens where it's misdiagnosed with it. I don't see it as much. Particularly, I don't really diagnose bipolar often or have it, that's not my specialty. So I don't see it as much in my office, but definitely anxiety and depression I can speak to. And the hard part is what comes first, the chicken or the egg, right? We might have always had ADHD. We could also have co-occurring anxiety that isn't organically present all the time, or it could be situational because of the ADHD, if that makes sense. So when I say an organic component, like I have brain chemistry, like I'm lacking or had too much of a hormone that's causing the anxiety functioning in conjunction with ADHD, or I'm feeling anxious because I have these ADHD symptoms that's causing this lack of self-confidence.
So kind of while we're on the topic of diagnoses, let's talk about parent concerns with getting a diagnosis, like concerns that the child will be labeled, and what the benefits to diagnosis are if you don't plan to get accommodations in school.
Okay, so there are definitely pros and cons to both. I would say one of the biggest pros to getting a diagnosis is if you want supports in school. Like you're not going to be able to get supports in the school system by way of an IEP or a 504. And some of the big supports are extended time on tests, extended time on SATs and ACTs, extended time in college courses when they're only 50 minutes to take an exam. You won't be able to qualify for being able to do like quality versus quantity by virtue of like I know the information, I know how to do it well. I can't sit for doing 25 math problems. Let me show I can do the work in 10. You're not gonna be able to receive those supports if you don't have the formal diagnosis. Some teachers are really wonderful, and this happened probably way more in previous generations of like, you just got the medications from the primary care doctor. You didn't need the diagnosis. You didn't need the data, which was where it led to people being overprescribed and inappropriately prescribed, which again leads to the stigma of like, oh my gosh, these ADHD medications are habit forming and they're harmful. And there's now a big concern where people are much more now much more kind of rigid in making sure you have the evaluation to qualify for medication, to qualify for the services in school, which I think is great because we're not just kind of giving these supports, not ever recognizing there's an issue, and then not providing enhanced support services to teach them how to learn to be flexible, to teach them how to manage their transitions and be able to transition adequately, to teach them how to organize their material, to teach them how to like help and improve their working memory speed, that kind of thing.
Yeah,
So-
we have a couple questions on kids with ADHD who are also high performing, so have like very high IQ or great grades. Do you find that it's harder for those students, those AB students, to get those accommodations? And also, is it possible that the child is sort of holding it all together at school and then lets it go when they're in the home environment?
100%, yes. And particularly kids who are high functioning and capable of being able to hold it together, they're definitely exploding more at home. And again, the pro to the diagnosis is this impeding, and this is where you guys have to determine, is this impeding their functioning enough at school and at home to warrant medication? And then you would need a diagnosis. And is this impeding home and school enough that you would want to risk the stigma of being perceived as a behavioral issue? And that is, I mean, those are kind of the two pieces. And a lot of times kids will come in and they're really anxious, they're really depressed, they've been white knuckling it for so long and they're tired. And it's like, well, I know you don't want the label, I know you don't want a stigma, but like, I think you have ADHD. And then they're relieved. Like, oh my gosh, there's not something ridiculously wrong with me. I just have ADHD. Guess what? You can take medication for that, or we can teach you skills on how to manage it without medication. And then you will feel so much better. And they're like, oh my gosh, thank you so much. I now have this label, and I better understand myself. And I'm not as don't have such low self-esteem because of it.
And just to follow up to that, do you find that those AB students have a harder time getting accommodations in school?
Yes. And a big piece of that is, I'm a big proponent of public school settings, but there's a lot of kids in public school, and there's a lot of there's very little opportunity for access to services. So if you're a high functioning student and you're doing really well, you're less likely to be able to qualify to get the 504 or the IEP, because you're not indicating that you need it. And that's not a bad thing. One of the pieces that you can do for those AB students is school. If you're doing well at school doesn't necessarily need to be involved. You can say, hey, here's private testing, or I've done the evaluations, I'm going to take medication or I'm not. Work and consult with your therapist on, these are the recommendations. And more often than not, I have teachers that are really, really open and willing to say, okay, I'll give you, and I'll support you because you are an AB student and you are doing well. I'll try to give you extended time. Let's see how it goes. And then we collaborate rather than go on this big kind of, testing assessment route, if that makes sense.
Mm-hmm. You also mentioned that there's sort of like a sigh of relief amongst kids once they receive that diagnosis. But we have a question about, how do we teach kids about their label and that it's not a disability, but merely a different way that their brain works? So maybe, I guess, both on an individual level and a societal level.
Yeah, I think that's what you say. I think that, this isn't a label, is not something that's going to be defining you. It's just a symptom of what you're experiencing. It's not who you are. And we are giving you the label and the diagnosis so we can help identify the supports that you need and help to understand what you need a little bit better, and also to help educate people on what you need. But it doesn't necessarily mean that there's this major problem. You're still you're still Susan, you're still kind and smart and athletic, and you just your brain happens to work a little bit differently. And if we can provide you support to surround that, you're going to be much more successful.
I would also add to that you may want to look into the neurodiversity movement, which started in the autism world, but I have definitely seen ADHD included in that now, and lots of other things are included in it, which is the idea that there's nothing wrong with brains that have these diagnoses. They just work differently, but there's not this normal or right way. And so maybe looking into that and pulling some information there may be helpful too.
Yeah. And I think characterizing it, that your brain, you don't turn off. Your brain is such a motor that you can go. And particularly on things that you find to be of huge value and that are really cool and you love, how great can you how much can you succeed at those things when you really dig in and you hyper focus? Most people don't have the opportunity to have that sustained attention. You would be such an asset. Also, you have such a high energy and like a love for, people and being open and out and engaged. Like people love being around you because you are so outgoing and you're so engaged with the world and like you do so much good and you provide so much support. It's like really framing it from this place of like love and nurturing and acceptance rather than this is a problem and this is what's wrong with you and this is what we're going to do to fix it. And the other piece of that too is really encouraging kids to find things that really enhance their supports and like or enhance their strengths. So the kid that does Legos and doesn't necessarily do well in sports, like let them do Legos, put them in the science club, help them learn robotics, like engage them in that piece. Like, kids who don't want to do sports, let them try guitar because they might really be able to hyper focus and attend to the guitar in a way I can't. And they would be such an asset. So helping to find those things that they enjoy. And I want to speak to that too with boys, girls too, but as they hit puberty and have that kind of impulsivity, risky behavior, help them to channel that impulsivity and risky behavior in a way that's positive and focus on activities that feels more risky and exciting, but that's done in a healthy way of like, I'm going to go four-wheeling. Like, well, let's teach them that they can go four-wheeling with their friends and with their mom and dad in a controlled environment and setting. And it's not so scary and they're not going to be risky doing other things, if that makes any sense.
Yeah, we do have one question sort of about that, and feel free to circle back if you'll address this in a different section. But if your child is diagnosed with ADHD, speaking of those behaviors, how do we still hold them accountable for their actions and responsibilities?
So again, they are normal children. Their brains just function a little bit differently and they need to be held accountable and they need to be taught structure and boundaries and discipline. So you would treat them with structure and boundaries and discipline in the same way that you would anybody else. So you give them a warning, you set the expectation, you give them a consequence ahead of time. And then when they get the consequence, you stick to it. And then through that, you're going to do that, but you're also going to give them lots of positive reinforcement and praise when they're doing things really well as a lot of added supports and efforts. Like they might be ones that even 14, 15 years old, they're like, you're giving the prompt of like, we're leaving in 10 minutes. You need to, in 5, go brush your teeth. Set the timer that you're going to go brush your teeth. And if they forget, be patient with them that they did it. Or, hey, like you have ADHD. And this is one, I have a girl that I adore. And it's like, she's getting mad because mom keeps nagging her to get out the door in the morning. And she's like, all right, 7:35, you want autonomy and independence. 7:35, if you're not out by 7:35, your phone's going to be gone for 24 hours if you're not out. There's the boundary, and she cares about the consequence enough to work on it. I am also going to wake you up, give you the prompt of what time it is, and I'm going to help set the alarm for you. Because she's not there where she can set her own alarm, but I'm going to set the alarm for you, and then I'm going to leave you alone. And if you can't get there, there's a consequence. So we're learning the skill, and we're teaching it with a lot of added supports along the way. And as they grow and as their brains continue to develop and evolve, those added supports are going to change and adapt and kind of you'll adjust those.
We have, let's do this question. And then I do want to, we don't have too much longer, so I want to hop on to a different topic, but I do want to ask this one. Could high achieving academic students who are like hyper focusing on academics, so they're like super successful in that area, but then other aspects of their lives are very heavily impacted by ADHD?
Yes, that can definitely happen. And I would encourage you, if that is the case, we always have to help whether kids hyper focusing on video games or hyper focusing on sports or hyper focusing on Legos. Like you have to disengage them from that with a lot of opportunity and like prompts, like in 30 minutes, in 20 minutes, in 10 minutes, in 5 minutes, we're going to get off of whatever. Hey, you are hyper focusing by 8:30. You have to be done with your homework. Okay, it's 8:15. You're going to need to be done with your homework in 15 minutes. So you're giving that prompt and flexibility and teaching them flexibility, teaching them like helping to understand transition time, but also then putting more on their plate. And then you're going to go have fun. And this is what fun could look like. I don't want to do that. I'm mentally exhausted. Okay, well, they might not be the one that's going to go do sports and run around and be wild because they're drained and exhausted. They've hyper-focused and used all their attention on school. Well, go color or read a book or watch a show, or, you know, you got to be mindful of like giving them room to kind of breathe and do their own thing, given what they're needing that moment.
So let's kind of circle back to medication, which we touched on earlier. And I know we had a couple of questions come in late this afternoon about medication. So I wanted to be sure to address those. So pros and cons, and then also kind of self-medicating with illegal substances as well.
Yes. So I will preface what I'm about to say with, I'm not the medication expert. Like, I'm not a trained psychiatrist or MD. So I want to preface with that. However, the best course of therapeutic treatment for kids with ADHD is medication in combination with behavioral, or, you know, behavioral modification and therapy, and providing them those supports. I, as a clinician, I probably am more med conservative than not. So when kids come into my office, I'll say, hey, you know, as a therapist, I'm going to tell you that that's what the research is. As a parent, I'm going to tell you that let's try everything we can in the next, you know, 10, 12 sessions and learn all the skills and the strategies and work really hard to implement them. And then if you're still not working, they're still not helping, and you're still struggling, then let's look at medication. And the pros of medication is it can decrease that, and it really just quiets the noise. So it slows the brain down enough to be able to like use those working memory components. So I'm going to be able to filter out the kind of the car speeding by, or the kid tapping on their desk, or mom talking, so I can focus on my homework. Or even I'm going to filter out the thought of like the tangential thought of like, what am I going to do for on the weekend, and be able to focus and attend. So that's the goal of medication. Kids who, you know, I'll see and they're like, you really need medications, like they're doing everything and they're still chronically irritable, or they cannot be motivated and activated because it's so emotionally and mentally taxing to be able to focus and attend. And those are likely a lot of the times the kids that do really, really, really well, because their motor is always running, and then they go home and they are like a puddle, like they just can't attend, can't engage, and then they're chronically irritable or anxious or frustrated. And speaking of medication, there's two different classes of medication. So you can do a stimulant medications. And there's a couple ways that they kind of work on your brain. Really, it kind of enhances dopamine. So, you know, increases the dopamine receptors and the hormone to kind of activate, you know, those brain systems. And then that's a stimulant medication. And then there's non-stimulant medications such as Strattera. There's about 20% of individuals who stimulant medication does not work for them. And that's where you would try a non-stimulant medication. Also, kids who might have a lot of co-occurring anxiety might benefit better from a non-stimulant medication, because if you have a lot of anxiety already, it can go one way or the other. It could either decrease the anxiety because the anxiety was kind of correlated to the ADHD, meaning I had ADHD and then I'm anxious because I have ADHD, or it's kind of working in tandem. If I take the ADHD stimulant, it might exacerbate the anxiety, and that's where a non-stimulant could be beneficial. So I have been scouring, because I had the big question too of like, and I hear it all the time in my office, can taking stimulant medication be habit forming or put you at risk for substance abuse in the future? And I was looking at meta-analysis of this with multiple different studies. And there's actually 3 studies that have found and indicated that kids who take medication for their ADHD with severe ADHD are less likely to engage in substance abuse than those who have severe ADHD and wouldn't. And that is, I think, what's really going on is there's impulsivity, risky behavior, and high anxiety, co-occurring self-confidence issues. Well, if that's what's happening and you're not, you know, they're needing the medication and they're trying everything that they're supposed to and it's not working, well, then we're going to kind of seek self-medication with other substances.
So while we're talking about that sort of self-medicating, we did have a question about marijuana use specifically. And that this person had heard that it could either be really great or like stay away from it. It's, you know, the opposite of being helpful.
Yeah. So I hear it all the time that marijuana can decrease my anxiety and help me focus and attend. And I will not argue with people because I've never done that to know. But also I would encourage people to really look at, like, done a lot of work with substance abuse, and marijuana is very much a gateway drug. Just the trajectory of marijuana to become addicted is longer than something, say, cocaine or heroin. And we don't ever really know, or do we have the gene, or is our brain wired that we're going to be addicted versus not? So you have to be very mindful. Marijuana, it could decrease your anxiety and help you focus on attend, but also you're running a huge risk of engaging and opening a Pandora's box and becoming addicted to a habit forming substance. And why risk that? So I would not be a proponent of trying it, even if it's
Another question on medications. Have you seen that kids where their medications seem to work when they were at in-person school, and then it seems to sort of be ineffective or counterproductive now that they're in a virtual setting?
Yes, for sure. And what's really, I think what's happening is we have pull kids out of in-person school and put them in virtual school, and we've never taught any child to have the skills to be able to do that. So it's not necessarily a medication issue. It's they do not have the skills to learn how to engage on a computer, be able to sit there for a sustained amount of time, be able to process the information in a way that, like, is different than what they're doing when they're looking at a teacher, hearing it and being able to write it down. So they're learning a whole new set of skills and they're floundering, and they don't have that other person being able to support them. And physical presence, like the energy that comes from somebody being present with you, is so empowering and so supportive and nurturing, and they don't have that.
A follow-up to that question was any role in something like QEEG, I'm not familiar with that, or SPECT scan in determining what type of medication would work best?
Yeah, so I'm not super familiar with it. You can, I mean, ideally, and I was talking with a colleague, ideally we would like everybody to get brain scans and see if your brain's ADHD, right? But it's really, it can be costly. There's not a lot of people that do it. I even think in Richmond, I think you have to almost go to Northern Virginia to be able to get it done. There's a high wait. But also there's like, I think it's genocyte testing. So you could look at that too, which people do. And it's, I believe it's like a blood test, and you can look and see what medications counteract or work well. Oftentimes with medications, and again, I want to be mindful, I'm not a medication expert, but if your sibling or your parent struggles with a similar mental health diagnosis, and then you take the mental health, you take a similar drug, it could work for you, where sometimes that's not necessarily the case. So, a lot of it, unfortunately, is throwing a dart at the wall and seeing what sticks. And that's sad because it's your kids' brains. But again, like, a lot of them work, and then for many, many, many kids, and then you have about the 20% that it's a crapshoot. So.
Along that same vein, can you speak to whether ADHD is hereditary or not?
Yes, ADHD is overwhelmingly hereditary. And you will see it in parents. I think the big issue is back when, parents were kids, it wasn't diagnosed. And then also, like, schooling wasn't the same when we were children as it is now. Like, there's a lot more experiential learning, a lot of more opportunities for engagement. The expectations socially were different then than they are now. And I think that's also why it's not necessarily diagnosed. So it's definitely hereditary. And the funny piece of that is, as you have kids, then you can start to recognize, like, oh my gosh, I did that. Did I have ADHD too? So a lot of times adults come in my office and are like, I think I have ADHD. I'm like, yeah, I could have told you that. But they're not picking up on it until their kid gets to the certain age where they're exhibiting behaviors that are ADHD symptomology.
So we are out of time, and I feel like we could have a whole other discussion about parenting with ADHD because that's a big topic in itself. And So I apologize if we did not get to your question. I do see that there are a couple questions about support groups. So I will include information. I'll get with Ashley, and if there's any information we can get to you about support groups, I will include that in a follow-up email to everyone. So again, I apologize if we didn't get to your question. Thank you so much to everyone for joining us this evening, for Ashley, for the amazing wealth of information, to Haley for helping us with our chat and questions. We hope you leave this evening with a few more tools in your toolbox for supporting the teen in your life. An audio recording of this event will be available, as well as a curated list of articles and links on ckgconnections.com. Our next conversation is March 17th at 7 p.m. Eastern Standard Time. It is a book discussion of The Explosive Child by Dr. Ross Greene. And I saw a comment at the very beginning. So we encourage you to read the book and be a part of the discussion. Ashley and I will be discussing the book. We unfortunately do not have Dr. Ross Greene coming.
I wish we did. I would show up for that one too.
It would be amazing. It's just Ashley and I, but we still hope that you will come. It is really a great book. So that's March 17th. So again, thank you so much for joining us, and I hope everybody has a great evening.
Thank you.
Thank you.
Thanks.